Hi, my name is Kelsey Ortman. I'm a nurse practitioner student through Maryville University. This is my final head-to-toe assessment. This is my volunteer patient. She's a 60-year-old female. We went ahead and started the exam by checking her vital signs, her height and her weight. I also went ahead and checked her visual acuity using the Snellen chart. She scored a 20 out of 20 vision in each eye, which is a normal finding. I also had her empty her bladder, and normally I would have a patient change into a gown before I begin the assessment, but for the sake of privacy for my volunteer patient, I'm going to go ahead and have her just keep her regular clothes on. So moving right into it, I would go ahead, look at her hair and her face. Her hair is blonde, it's thick, I don't notice any thinning, there's no alopecia or anything. The skin on her face is intact, there's no wounds, no redness, no abnormal discoloration, there's no obvious deformities of any kind. I'll go ahead now and check cranial nerve number 7. If I could have you puff out your cheeks, clench your teeth, close your eyes very tight, smile. Okay, great. Cranial nerve number 7 was intact. Now I'll go ahead and move into palpating her scalp and her face. No bumps, no deformities again, no tenderness as I'm palpating. Moving into her facial bones, they also feel intact, no deformities or bumps. Checking her sinuses, there's no tenderness upon palpation. Checking her TMJ, there is no abnormal clicking or rubbing or anything, which is all normal findings. Now I'll go ahead and check cranial nerve number 5, which is checking sensation in her face. So first I'll give you an example of what each feels like. This is sharp, this is dull, and this is soft. Okay, you ready?
Mm-hmm. Soft, sharp, sharp, soft, sharp, dull, sharp.
Okay. Sensation was intact in her face, which means her cranial nerve number 5 is intact. This is all a normal finding. Now I'll go ahead and move into her eyes. Her eyebrows are blonde, so they're a little bit thinner, but they are intact. They extend out to her outer canthus. Her eyes also, there's no ptosis in her eyelids. There's no obvious swelling or deformities, no redness, no drainage. Her sclera is white. Her conjunctiva is pink in both eyes, which is normal. Now I'm going to go ahead and check a few things here. I'm going to check for her pupils. I'm going to shine a bright light in your eye here real quick. Pupils are equal and reactive on each side, which is a normal finding. Now I'm going to check for her red reflex in each eye. Red reflex is also intact, which is a normal finding. And now I'm going to go ahead and palpate her eyebrows. Intact, no bumps, no deformities. Lacrimal gland is also intact. There was no tenderness upon palpation. And again, like I said, there was no drainage coming from her eyes before or anything. Her vision test was already completed with the Snellen chart before the exam, which was normal. And now I'm going to go ahead and check, I'm going to do the cover-uncovered test to check for nystagmus or other abnormalities. If you go ahead and close one eye for me and look at me. Okay, down and do the other one. Okay, great. Her pupils stayed equal. It constricted and dilated appropriately. There was no nystagmus in her eyes or anything. That was a normal finding. I'm going to check cranial nerves numbers 3, 4, and 6 now, which are her ocular motors. If you would go ahead and follow my finger for me. Very good. There you go. Ocular motor was intact. Last test was confrontation. She was able to focus on my finger properly. Again, no nystagmus or anything like that. No drifting of her eyes, which were all normal findings. Now I'm going to go ahead and move into her ears. They are symmetrical. They are equal in alignment. They extend to the outer canthus of her eyes, which is normal. There's no redness. There's no obvious deformities or anything like that. There's no drainage coming from her ears. She's been responding appropriately to me so far during this exam, which shows that so far she's been able to hear properly. But I'm going to go ahead and do a more extensive hearing test and then test her with the tuning fork. which would be testing cranial nerve number 8. So first off, if you would tell me if you can hear this equally in both ears.
Yep.
Okay, great. Now this time I'm going to put it behind your ear. I want you to let me know when you no longer hear it, okay?
Okay. And stop. Stop.
Okay. Go ahead and test the other side now.
Stop.
Okay.
Stop.
Okay. Hearing was intact in both ears on that. Air conduction was twice as long as bone conduction, which is a normal finding. Now I'm going to go ahead and do the whisper test on her real fast. If you would go ahead and cover this ear for me and repeat back the 3 words that I say to you.
Blue dog green.
Perfect. Go ahead and test it on this side. Yellow cat mouse.
Yellow cat mouse.
Perfect. She responded. She repeated the words back to her that I told her. So normal findings on her whisper test as well. So hearing was intact. Now I'm going to go ahead and check the insides of her ear. Sure there's no abnormalities there. I'm going to pull her ear up and out. There's no redness, no drainage, a little bit of some cerumen, which is a normal finding. Her bones are pearly gray and her tympanic membrane is intact. These are all normal findings on this ear. Let's go ahead and check out this side. Again, no drainage, no redness. Tympanic membrane is intact. Bones are pearly gray. There's no pain upon looking inside her ears, which is normal. I'll go ahead and palpate them now. There's no bumps, no tenderness when I'm touching her ears here. I don't feel any deformities of any kind, which are all normal, so normal ears. Go ahead now and move into her nose. Her nose is symmetrical. There's no obvious deformities, no bumps, no abnormal discoloration or anything like that. Go ahead now and look at her septum. Her septum is symmetrical so far looking up her nose, which is a normal finding. I'm going to go ahead now and have you occlude one of your nostrils and breathe in. All right, go ahead and occlude the other one, do the same thing. Were you able to breathe equally on both sides?
Yes.
Okay, so her both nares were patent, which is a normal finding. I'm going to go ahead now and just take a look up her nose here. Nasal mucosa is pink and moist. No redness or polyps or anything. Doesn't look like she's having any issues with allergies. There's no drainage. Her turbinates are intact and symmetrical, and I can see her septum go up, and it is also symmetrical. So all normal findings within her nose. And now I'm going to go ahead and just palpate her nose. No tenderness upon palpation. Again, no bumps or deformities or anything like that. Now go ahead and take a look at her mouth. Her lips are symmetrical. I tested her smile earlier. It was also symmetrical. There was no droop on either side. There's no obvious wounds, lacerations, anything like that on her lips, which is normal. Now if I could go ahead and have you open your mouth for me. Okay. Her mucosa is pink. It's intact. There's no wounds. It's moist. Her teeth are intact. Her gums are pink. I don't see any bleeding or irritation. If I could go ahead and just have you stick your tongue out for me so I can see the back. You can see her uvula is midline. Her posterior pharynx is intact. She told me earlier that her tonsils were taken out, so I cannot visualize the tonsils, which would be normal in her case. If I could go ahead and have you raise your tongue for me. Floor of her mouth is also normal, moist, no wounds. She's able to lift it freely, which are all also normal findings. Also look at her palate. If you could open your mouth for me again. Her hard and soft palates are also intact. Normal findings there. I didn't notice any abnormal odor from her mouth or anything. Like I said, her teeth were intact. I'm going to go ahead and test cranial nerve number 7. If you could stick your tongue out for me again. Move it side to side. Lift it up and down. Okay, great. It's intact. She was able to follow commands with her tongue, move it freely. No abnormal findings there. If I could go ahead and have you say ah.
Ah.
Great. And now I'm going to go ahead and check for your gag reflex here. Okay, gag is also intact, so cranial nerves number 9 and 10 are also within normal findings. Go ahead now and look at her neck. Her neck is symmetrical, it is supple, it's midline, no obvious abnormalities, there's no JVD on either side. Her thyroid, I don't notice any goiter of any kind or anything which would be abnormal. I'm going to go ahead and test cranial nerve number 11 now. If I could go ahead and have you do a circle with your neck here. I'm going to put my hand on your face and I just want you to push against it. Okay, this side. Great. Raise your shoulders. Push out. Okay, and then just have you shrug your shoulders for me. Take it in a circle. Okay, she had proper range of motion, was able to follow commands. No abnormalities there. Now I'm going to go ahead and palpate each of her carotid arteries, but they should be done separately. Okay. No abnormal findings there. There was no abnormal pulsations. There was no thrills of any kind or anything. Now I'm going to go ahead and palpate her trachea here. It's midline, again, no abnormal bumps or anything. I don't feel like an abnormal goiter or something from her thyroid from the front. Go ahead and kind of palpate from behind. If you could swallow for me. Okay, great. I can palpate her thyroid, or I was able to palpate her thyroid, but it didn't seem abnormally big or abnormally small or anything like that. These were normal findings. I'm going to go ahead now and palpate her lymph nodes. Go ahead and do pre-auricular, post, do occipital, submandibular. Is there any pain or tenderness when I'm palpating any of these?
No.
Cervical, deep cervical, clavicular. Go ahead and feel your axillary. Okay. No abnormalities, no tenderness upon palpation. I didn't feel any abnormal swelling or edema or anything, no bumps. So her lymph nodes were all normal. Now I'm going to go ahead and auscultate her carotid arteries. And then into her thyroid. Okay, all normal findings there. There was no bruise. I didn't hear any abnormal pulsations or anything. Thyroid, I didn't hear anything abnormal there. All normal findings. Now I'm just going to go ahead and move into her extremities here. Take a look at her shoulders, the skin there. Skin again is dry and intact. I don't see any obvious deformities, no lesions or anything, no rashes, no wounds. I'm going to go ahead now and take a look more down at her hands here. Fingernails are intact. Nothing abnormal on her fingernails. Good cap refill on either side, which is a good sign of perfusion all the way down into her hands. I'm going to go ahead and feel for her radial pulses here. Radials are 2+ equal on each side. Brachial pulses are also 2+ and equal on each side. Go ahead, oh, I'm so sorry. Just palpate the skin here in her arms, shoulders and everything. There's no tenderness. I don't feel any bumps. I don't feel any deformities. There's no tenderness going on back there. Now I'm going to go ahead and move on into her back. Take a look at her spine here. her spine is normal. There's no bulging, no kyphosis or anything. Her skin again is intact. There's no lesions, no bumps of any kind. There's no abnormal rashes or discoloration of any kind. I'm gonna check for CVA tenderness, simple palpation. Is there any tenderness when I was
No.
palpating right there? Okay, awesome. So that could be a sign of like kidney infection or something like that, but she didn't have any tenderness, so no worries about anything like that. I'm gonna go ahead and auscultate. She had clear breath sounds on either side, bronchovesicular and vesicular. There was no adventitious sounds of any kind, no coarseness, wheezing, anything like that. Now I'm gonna just go ahead and percuss her lung fields. And then lateral. Lateral again. Okay, again, bronchovesicular and vesicular noises, normal findings upon percussion. I'm gonna go ahead and just palpate back here. There's no tenderness in her spine or her back anywhere, no bumps of any kind. I'm gonna go ahead and test for tactile phrenitis. If you would just say 99 for me.
99, 99, 99, 99.
Okay, normal findings there on her back from no tactile phrenitis there. Go ahead and check from the front now. Go ahead, just taking a quick look at her chest here. No abnormalities on her skin or anything. Skin is intact, no lesions again, no abnormal discolorations of any kind. Go ahead, take a listen here. Go ahead and listen to our heart sounds on here. No abnormal. Her lungs were clear again, bronchovesicular and vesicular noises. Upon listening to her heart, I heard S1, S2. There was no murmur, palpitations, or anything like that. All normal findings. Now I'm gonna go ahead, just taking a quick look at her again. There's no obvious signs of respiratory distress. I don't hear any adventitious noises coming from her, like she's gasping or air hungry or anything. Looks like her respiratory rate is about 16, which is a normal finding. Go ahead and check for her expansion. Take a deep breath for me. Great, she had normal expansion. And then looking at her AP, it's about a 2-to-1 ratio, which is a normal finding. 2 to 2, or having it bigger would be signs of like a barrel chest, which could be a sign of like COPD or something like that. So normal, checking tactile phrenitis in the front. If you could just repeat 99 for me again.
99, 99, 99, 99.
Okay, great. Again, no tactile phrenitis at the front. Moving into percussion. Okay, do the lateral side again. Okay, percussion was normal again. No, it was bronchovesicular, vesicular noises. So lungs all normal. Go ahead and feel for her apical pulse here. It's normal, no abnormal pulsations or anything. Now I'm going to go ahead and have you, if I could just go ahead and have you lay on your left side for me. I am going to feel her precordium here, palpate. I don't feel a thrill or a heave or anything, no abnormalities upon palpation there. And go ahead and sit back up for me again. So now I'm going to go ahead and, I'm sorry, you can go ahead and lay back down again because we're going to go ahead and move into your abdominal assessment now. So for the abdominal assessment, I'm going to go ahead and just first start by inspecting her skin here. I don't see any abnormal pulsations or anything, no bulging, like no signs of hernia or anything like that. There's no bumps, no bruising, no striae or just abnormal discolorations in her skin anywhere. So now I'm going to go ahead and auscultate before percussion. So I'm going to start with her bowel sounds. She had normal active bowel sounds, which is all normal. Go ahead and listen to the arteries in her abdomen now. Aorta, renal, iliac, and then femoral. Okay, no abnormalities in her arteries anywhere as well. There was no bruise or anything like that. So normal vasculature in her abdomen then. So now I'm going to go ahead and percuss her bowel. Okay, normal percussion. I heard tympany in all 4 quadrants, which is a normal finding. You can actually percuss to estimate the size of the liver. So coming down this way, once you hear dullness, that's when you hit the liver. Okay, now go to the outside. Okay. Okay, about 7 centimeters on her liver, which is normal finding. Go ahead and percuss for dullness on her spleen over here. Okay, so normal findings, her spleen, there was dullness there. I'm gonna go ahead and start with some light palpation of her abdomen. Is there any tenderness when I'm palpating here?
No.
Okay. I don't feel any bulging or hernia. There's no tenderness. I don't feel any edema. There's no rebound tenderness over here. I'm going to palpate her liver. Is there any tenderness when I'm palpating?
No.
Okay. It doesn't feel like abnormally large or anything. There's no tenderness upon palpation. I'm going to try to feel for her spleen, but won't necessarily. We'll see. Not able to feel her spleen, but that's not abnormal. If you are able to actually palpate someone's spleen, it could be indicative of an infection like mono or something like that. So not abnormal that I can't feel. I'm gonna go ahead and feel for kidneys now. Okay, kidneys, no tenderness or anything there.
No.
Okay, again, kidneys are normal on either side. There was no tenderness or anything upon palpation. So now just feel pulsation of her aorta. No abnormalities there. I don't feel any bruit or anything like that. Rills or anything. If I could just have you lift your head up a little bit. Okay, great. Just palpating the muscles in her abdomen. You can go ahead and relax. I didn't feel any splitting in the muscle or anything like that. No hernia when she's doing that, which is all normal findings. Now if I could go ahead and finish there. Go ahead and sit up again. So moving into the skin, moving down her legs, skin again, dry, intact, no abnormal discolorations, no bumps, obvious deformities of any kind. I'm going to go ahead and feel the muscles in her legs. Feel for bulging or anything. Muscles are equal on each side. No abnormal hair growth anywhere or loss of hair anywhere. There's no pain upon palpating any of her extremities or her knees or anything. I don't feel any deformities or bumps or bruising or anything. Looking at her feet, again, she has normal cap refill in her feet. There's no abnormalities in her toenails or anything like that. She's got proper perfusion down into her feet. So now I'm gonna go ahead and, the temperature was warm. There's no diaphoresis or anything like that. Checking for edema, no edema in her legs or anything, which would be sign of like water retention, but there's no signs of that. So now, go ahead and also I forgot to do pulses here. So check her pedis, posterior tibialis. Check her popliteal here real quick. Okay, pulses are 2+ on each side, which is a normal finding. So throughout the exam, I had actually been testing her cranial nerves. The only one that we hadn't really touched on was her cranial nerve number 1, which is sense of smell, olfactory. To test this, you would just have someone occlude their nostril, breathe in, see if they can differentiate what they're smelling. No need to test that for this exam because she hasn't really shown any abnormalities neuro-wise, but that is how you would go ahead and test for that. I'm going to go ahead and test sensation and the rest of her extremities here. I'll go ahead again and show you what each feels like. This is dull, this is soft, this is sharp. I can go ahead and have you close your eyes for me.
Soft, sharp, dull, soft, sharp, sharp, soft, dull, sharp, 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 soft, soft, sharp.
Okay. Proper sensation in her extremities, normal findings upon sensation there, which is normal. I'm going to go ahead and check her reflexes. Go ahead and check brachial here. Just have you rest into me. Okay, normal. Okay, that's normal. Go ahead and check. Just try to relax your leg as much as possible here. Alright. Okay, and then just the Achilles. Okay, reflexes were all intact. There was no clonus or any hyper or hypoactive responses from her reflexes, which is all normal findings. So I went ahead, when I was looking at her back, looked at her thoracic spine, but just go ahead and take a quick look at her cervical spine and then lumbar spine here. Again, I don't see abnormal bulging or kyphosis or anything. It's symmetrical. There's no tenderness when I palpate either one, which are normal findings. Now I'm going to go ahead and just have you test muscle strength here. If you can grip my fingers, pull me towards you, push me away. Great. Can you wiggle your toes? All right, push down against my hands and then push up. Great. And then I want you to, I'm going to push down against your shins here, push against me. Great. Normal muscle strength in all of her extremities, which are normal findings. If I could go ahead and just, last test, have you stand straight up. And then I just want to see you squat down. Okay. Normal findings there. You can go ahead and have a seat. Do you have any questions for me about your exam?
No.
Okay, and that concludes my head-to-toe assessment. Thank you very much.